respected judges and my colleague here. My title is Early Division of a Cutler beard using a tissue expander for breech flap and filamentous knitted polyester fabric for tarsus replacement. No financial interest. Upper lid reconstruction is always a challenge. Large defect involving 60 to 100% needs tarsal plate replacement and for architectural support. The Cutler beard, a two-stage procedure, modified using a novel tissue expander by the balloon of 10-14 French silicone catheter. It recruits extra tissue from the skin and subcutaneous muscle complex for breech flap. Novel filamentous knitted polyester fabric as a suitable replacement for tarsal plate, allowing an early division at 2 weeks instead of 6 to 8 weeks. Purpose: to assess the safety outcome, efficacy of early division of Cutler beard at 2 weeks. Use of novel filamentous knitted polyester fabric in replacement of upper lid tarsal plate architectural support after resection of a large upper lid tumor to estimate the functional and aesthetic outcome. Prospective interventional study of the patient of 10 patients. Target is 30. Second stage of CV was done on 2 weeks. The created defect pre and post measurement, MRD1, PFH, LPS actions are noted. The balloon of 10-14 silicone Foley's catheter used as a novel expander device. In graded inflation for 3 days. On 4th day, the balloon is deflated and the Cutler beard procedure done. Baseline Doppler flowmetry at marked area after short duration of tissue expansion. Again, deflation. Again, do Doppler flowmetry to assess the flap vascularity. Inclusion care, all upper eyelid malignant tumor, upper eyelid created defect. 100% involvement of local lymph node, exclusion criteria, distant metastasis, liver, lung, brain, associated lower eyelid involvement, gross corneal infiltration. Now comes to the video. This is an ellipsoid area which is marked the infraorbital area. Baseline Doppler flowmetry done to estimate the vascularity of that area. The balloon of the 14 French catheter graded inflation for 3 days. On 4th day, it deflect. That means a tissue is recruited there and tissue is left. Again, do a Doppler flowmetry for check the vascularity. Vascularity is increased. Cutler beard stage 1 done. This is an advancement flap, which is separated anterior posterior lamina. This separation is much easier when you do expansion of the tissue. Then filamentous knitted polyester fabric used as a tarsal plate replacement over the posterior lamina bay. It is fixed with a 5-row polygalactin and it is sandwiched with the anterior lamina. This is the after 14 days. After 2 weeks, we separate anterior posterior lamina. This is the post-op image of this patient. So MRD1 minus 1.80 to plus 466, pre-op PFH value 1.6 to 11.25, LPS action 1.5 to 14.5, and Doppler flowmetry study is pre-systolic velocity 6.98 to 10.90 millisecond, end diastolic velocity 2.36 to 3.6 second per millisecond, pulsatile index of 1.28 to 1.7, resistive index 0.6 to 10, number of vessel increase, diameter of the vessel increase, blood flow increase, easy separation anterior posterior lamina. All cases of elliptical filamentous knitted polyester fabric is used as a tarsal plate replacement in this study. Dimension is 28 mm length, 6 mm central wide with a multiple hole. It is flexible, pliable, inert, tissue friendly. Expansion of tissue in elliptical manner preoperatively recruit extra tissue for breech flap formation. That is why the early division is possible in 2 weeks. Good healing due to increased vascularity, proof by Doppler flowmetry, increased vascularity, the data shows. Cutler beard procedure, the stretching effect already done by balloon of the 10-14 French balloon. In Cutler beard procedure, that is 6 weeks is not required for stretching effect. So comes to a conclusion, useful in one eye patient, tissue acceptance is excellent, no such graft failure infection, exclusion of the FKPF, overall architectural support of the lead is well maintained and excellent aesthetic appearance. Short duration, rapid expansion of the skin muscle complex shows the increased vascularity with the Doppler flowmetry study. It causes extra tissue recruitment that helps in early division of breech flap and good healing of the wound. Thank you.
Thank you, Dr. Mandal. That was an excellent presentation, a very good innovative technique. Tell me, so the time of leaving the tissue expander, was it the same for all the cases?
Yes, we have a tissue expansion in every day. When you start this study first, it is in 15 days. But 15 days, the tissue will not relax. It is become a fixed swelling. Then again, reduced to a 7 days. It is relaxed, but it is long duration. You have a temporary deformity face that is not accepted by a patient. And in the hospital stay for 7 days is too long. So again, you reduce to 3 days. 3 days is optimum. We are doing this expansion for the last 4 years. Now, we applicable before that in tangible rotational flap and published in Indian Journal of Ophthalmology. Now, we did this theory for expansion of the tissue for bridge flap formation for early division of Cutler beard procedure. And it is success.
Okay. Sir, what will be the exclusion and inclusion criteria in your study?
That is given here in the slide. That is inclusion criteria is 60 to 100% defect. And gross corneal infiltration is exclusion criteria. Metastasis is exclusion criteria. This is all the Cutler beard where the study is given here, yes. It is fully given here.
Okay. Were there any recurrences were there any recurrences in your cases since you've been doing it for 4 years?
No, yeah. One of the author is done in UK for 4 cases of early division of Cutler beard procedure, but there has a complication of stretching effect because there is an entropy and ectopy developed because tissue is not stretched. The concept is that expansion of the tissue. In Cutler beard, basically a tissue expansion. We are already done by the balloon of the 10 French 14 catheter before.
I'm just asking, in your cases, were there any recurrences of the primary tumor?
No. This we do margin control in every cases. Okay. So that is why in our study is not record till now. After 2 to 3 follow-up, then we can again see. This is a new study after doing 1 year. We are doing only 14 cases, 10 year, but 14 cases we have already done. Our target is 30.
Okay. And I'm presuming these are all upper lid tumors. You're doing the expansion in the lower lid.
In this study.
Yeah.
We can applicable the expander anywhere, except over the eyelid. Yeah. This expansion only for 4-dimensional, but the other expansion is 3-dimensional.
Okay. Thank you.
What is the cost of this tissue expander?
Hello?
What is the cost of this tissue expander?
Tissue expander, it's a balloon catheter.
So how much is
300 rupees.
And for every case you are using the needle?
Yeah, 300 rupees per case. This is available in the hospital.
Okay, thank you, Dr.